Okay, y'all.
The coronavirus vaccine has come to Albany, Georgia. Dr. Eddie Black, the head of the ER, got the first shot at Phoebe Putney, the only hospital in town. Bigger places got the vaccine first. Here in the southwest corner of the state, a later than expected arrival in a place where the virus showed up early.
It's grief, fear, confusion, anger, and of course, anxiety about what the future is going to bring. Why did it strike Albany, Georgia?
That was Mayor Bo Dura at the end of March. But even now, the question lingers.
Mentally, I think it devastated our community.
A community that lost leaders, longtime residents. Among the Black community, a profound loss. But
their family members still to this day will not admit that they passed away from COVID-19. So immediately there's like this stigma that people don't want to say out loud that they died because of COVID-19.
It was late March when Dougherty County and Albany became one of the early hotspots in the country. A funeral brought a visitor, then the virus, but no one really knew that, not then. This is the South, and
we are a close-knit community. We love hugging, we love kissing, we love getting together.
But the virus spread, the numbers exploded.
Just shock, of how quickly it moved through our community.
Month of March, I think we had 36 deaths. The month of April, it was like 89, I think. I mean, it blew up.
Albany soon had more cases than Atlanta, which is much larger. Phoebe Putney stood up more ICUs just for COVID. It made its own PPE, right down to the plastic face shields. 9 months later,
I would tell you, it's been heavy. We look back and if we talk about those early months, it's a bit of wonderment that we did what we did and pride. But there's a lot of emotion. People haven't had time to process those feelings. And, I think that's still to come.
The number of cases and deaths declined as the months went on. But the outbreak here did not just take lives. It also exposed deeper problems around race and access to health care in an area where more than 70% of the population is African American.
So COVID-19, we know, preys on pre-existing conditions. And here in Albany, we already had so many pre-existing conditions, like some of the highest health rates of diabetes, HIV, heart disease, cancers, sickle cell. All those were already here before COVID came.
Some members of the Black community felt singled out, blamed for bringing in the virus.
I think people became shamed and did not want to say out loud, that they were suffering. And so I think to place the blame on people who are actually the victims of this pandemic was just not the best way to address it.
With the end of the pandemic seemingly in sight, a new challenge, getting people to trust the vaccine. That
is a hard sell, based on, the past with the various, Tuskegee and all the other things that have happened, in the past of distrust with Black Americans. And so I definitely think your average Black person is going to say, I ain't taking that. I'm not taking that.
There's this feeling that the preference would be to see it run its course, to see others take it, possibly our essential workers, our frontline people take it first, to ensure that we are not the ones being, experimented on when it comes to this vaccine.
Those in medicine know the challenge ahead.
We've got to get out there and we've got to lead by example, right? It's not do as I say, it's do as I do. It's showing people I took it, it's safe.
In Southwest Georgia, the vaccine's arrival offers hope, but to heal, that will take a reckoning with the past.
I think the fear is that after all that we've been through, we just don't learn. We just remain the same and continue to go on as before.
Because so many went to the grave and family members was not able to say goodbye. So many who died in the hospital on the respirator, you could not go back there to see them leave. So it was no closure.
We always have America's back. We needed America to have our back during this pandemic, and I don't think they did.